In our quest to improve the quality of life of people with Prader-Willi syndrome, there's no time to stop. No breaks, no rest. We recognize the robust research and progress already achieved through the powerful alliance of patients, parents, families, physicians, and researchers. At Soleno, our goal is to address the challenge of PWS and to develop a safe and effective treatment. And we can't get there without you.
As a parent of a child with PWS, I've learned that I need to use my voice to help advocate for my daughter. We are the voice for our children.
To the patients with PWS and your families and friends who struggle to live a full life with this rare condition, we hear you, we see you, and we support you.
Your passion, energy, and commitment inspire us daily in our quest to improve the quality of life of people with PWS.
Your resilience fuels our determination to develop a treatment that could truly change lives. We're making a difference together.
Welcome everyone to our virtual 2021 PWS Family Conference presented by Soleno Therapeutics. Before we begin today's presentation, let's first thank our amazing sponsors: Soleno Therapeutics, Levo Therapeutics, Harmony Biosciences, Radius Health, Inversago Pharma, Saniona, Conscience Therapeutics, and Novo Nordisk. Their support allowed us to make this conference free for all community members, and we are incredibly grateful for their contributions. In today's session, PWS Mental Health Challenges, Dr. Lauren Schwartz, PWS parent and psychologist, will talk about how we can effectively assess and manage mental health issues if they arise in our loved ones with PWS. Dr. Lauren Schwartz is a clinical psychologist and professor at the University of Washington School of Medicine, Department of Rehabilitation Medicine. Her work at the University of Washington focuses on the area of adjustment and recovery from disability and serious chronic illness such as stroke, brain tumor, spinal cord injury, and multiple sclerosis. She has a particular interest in the impact of disability on families and how to help families best cope and adjustment to their new normal. Dr. Schwartz also serves on the FPWR Scientific Advisory Board and is a member of the FPWR research team with a focus on facilitating and overseeing the PWS mental health and behavior research programs for the foundation. She and her husband, Mark, have 2 children, including a 22-year-old daughter with PWS. Without further ado, I welcome Dr. Lauren Schwartz.
I'm glad to be here today. I'm sorry we can't be in person, but hopefully next year. As Melissa mentioned, I'm going to be talking about, I guess I should share my screen. I'm going to be talking about a project that we did on mental health issues in PWS, focused on understanding the challenges from both a parent perspective and from the perspective of experts in the field. So why a mental health guidebook? Mental health issues are common in PWS. People with PWS may present symptoms that are unique to the syndrome. And we've heard from many parents that these symptoms can be challenging to assess, to understand, and to get appropriate treatment for. So we thought it would be helpful to do a project focused on this to help parents understand what to expect, how to identify early symptoms, when and how to get help if their loved one is struggling with mental health challenges. So a roadmap for today's session. We're going to talk about what mental health challenges look like in PWS, what are the early signs and how to best intervene, when to monitor behaviors and when is it time to get treatment, and the use of medications and non-medication approaches to treatment. Please note that PWS is a spectrum disorder, and mental health issues will vary among individuals with the syndrome. Some individuals will have no challenges in this area, and some will have a few, and some will have quite significant challenges. So the information I'll present today won't apply to all individuals with PWS. The Mental Health Guidebook, which is kind of the outcome of the project that I did, which I'll be telling you about today, is available on the FPWR website for download. So you can download that later today or some other time, and you can share it with whoever you think might be useful to share it with, providers or family. There's also a one-pager that summarizes the findings very briefly, which could be useful to share with a healthcare provider. And one more point I want to make before I launch into the study findings is that I know that this is a hard topic and it can be a difficult reality for parents of those with PWS. But as challenging as the situation can be, there is reason to be hopeful. Many of our kids do respond to available treatments for mental health symptoms, and we really do have some great dedicated professionals in our community, as well as wonderful parents who've been there and are willing to share their great wealth of information. I feel like we're really blessed with a great PWS community, and I want to acknowledge the contributions of all the families and experts who gave their time for this project. So the first poll question. And with this, I'm interested in finding out the ages of the loved ones with Prader-Willi that you all have, and that will help us sort of guide some of the discussion today. And we'll keep the poll up for a few more seconds so everybody can weigh in. My guess is most of the parents will have loved ones with older kids, but we'll see. So it looks like we have a nice spread actually across all the age groups with a little bit of a tendency towards the over 18 group. So great. So now on to some of the specifics of the study. The information presented in the guidebook was gathered from extensive one-on-one interviews with caregivers whose loved one with PWS was over the age of 10 and had experienced serious mental health challenges or very severe behavioral issues. And these caregivers were recruited on email and social media. I also interviewed 8 experts in the field of Prader-Willi, and they were clinicians and researchers with extensive experience in the area. And as you can see at the bottom of the slide, the mean number of years that these experts have been working in PWS was 19 years. So these are folks who've been in the trenches for quite some time. This slide summarizes some of the background information on the caregivers who participated in the study and were interviewed. We had 15 caregivers participate, and the mean age of their loved one with Prader-Willi was 21 years, but the range was 12 to 32 years. Most of those with Prader-Willi were male, and most had the genetic subtype of UPD. Most were still living at home with parents, and most of the caregivers I interviewed were moms, but I did get to interview a few dads, so that was great to have them participate. The guidebook is really focused on serious mental health issues. We know that people with Prader-Willi have a variety of behavioral challenges, including anxiety, skin picking, repetitive questioning, temper outbursts, but the guidebook really focused more on serious mental illness and issues in PWS because there are fewer resources for parents in this area. So many of the individuals that the interviews were focused on had struggled with severe clinical anxiety, severe clinical depression, psychotic symptoms, bipolar disorder or mania symptoms, or severe escalation of core PWS behaviors to the point of crisis. In terms of age of onset, most of the families reported that the mental health symptoms started early in adolescence, around or after age 12. So poll question 2, we'll have a couple of polls here while we talk, just to get a sense of who our audience is. And for this poll, does your child or loved one with PWS have any of these mental health conditions or symptoms? And this can give us a sense of kind of who's in our audience and what some of your loved ones have struggled with. We'll give a few more seconds for folks to complete that. Be very curious to see the results. I know what I would be checking for my daughter. Anxiety, yes, that would be number one in our house as well. So looks like kind of a range of challenges, and I think pretty consistent with what we find in the literature in terms of struggles with mental health issues. So great, thank you everybody for sharing. So now kind of on to the some of the findings from the interviews, and I want to talk about some of the themes that came up in the interviews. One of the first big themes that came up was difficulty distinguishing between typical PWS behaviors and serious mental illness. Caregivers, and this was a challenge not only for the caregivers, but also even for the experts at times. Caregivers and experts noted that during times of significant increases or change, and there were core PWS symptoms, either alongside with psychiatric symptoms or sometimes as a precursor to more serious symptoms. You can see on the slide some caregiver comments. One caregiver stated, at first it just looked like PWS, but worse. And another insightful caregiver noted, it took us a surprisingly long time to say, gosh, this is mental illness. And we're not uneducated about these things, but we just didn't see it. So if you're starting to see something that concerns you and that seems like a change from your child or loved one's baseline, families and mental health experts recommended that you start to track behaviors. And this can be done simply by putting check marks on a calendar or notepad indicating frequency or intensity of symptoms. I recommend in terms of intensity, something like a 0 to 10 scale. And you can note 1 or 2 behaviors that you're concerned about, like anxiety, outbursts, or changes in sleeping. Additionally, there are a number of behavior trackers online, and you can use your smartphone to track behaviors as well. What can be useful is that if you do end up needing to get an assessment for your child, you can bring in this information, could be helpful. Another theme that arose in the interviews was it was important to keep in mind a few key risk factors or potential triggers for mental health challenges for those with PWS that are really somewhat unique to the syndrome. The first is genetic subtype differences, and many of you are likely familiar with the research that shows that PWS by UPD has a high risk of psychiatric symptoms. But people with deletion subtype also have an elevated risk compared to the typical population. And this was a point that the experts in particular wanted to make during the interviews. And as you saw in the demographic slide earlier, a third of those that we interviewed did have the deletion, or their loved one had the deletion subtype. The second issue is stress sensitivity, and many of you may already be aware of this in your loved one, but that many individuals with PWS are highly stress sensitive. So what does that mean? That means that seemingly small changes which wouldn't trigger significant mood symptoms in maybe the typical population can have the potential to cause psychiatric symptoms or could lead to a relapse in someone who's vulnerable. And for example, some of these changes that I heard about from caregivers in this study were a change in a caregiver or teacher, parent going back to work, illness in the person with Prader-Willi, which several mentioned was a trigger for symptoms, or illness in a close relative, moving or changing homes or schools, etc. It's important to note here that while some of these triggers might be expected to cause stress and mood impacts, such as serious illness in a loved one or death of a loved one, others really represent situations that would not normally be associated with significant mental health symptoms or a crisis, such as being assigned a new aide at school. So this really underscores the mental health sensitivity of some individuals with PWS to seemingly small changes in their lives. The third theme that came up was this, an issue around imaginary friends. So it's common for people with PWS to talk to themselves and to have imaginary friends. And this does tend to go beyond the age when typical kids do this, but I think this is fine for many kids with PWS. This is a kind of a soothing strategy. It helps them maybe process or work through some of the things that have happened during the day. But it's important to be aware of the baseline in this behavior for your child. If the amount of talking significantly increases, or this sort of friend becomes scary or mean, this is concerning and would warrant assessment by a healthcare professional and possible treatment. And experts gave some suggestions on how to kind of talk to your loved one about this, their symptoms, and those are in the guidebook. In the interest of time, I'm not going to go through those today, but you can find them in the guidebook. So what should you look for? In addition to the above kind of special considerations, 4 key factors came up again and again as kind of concerning behaviors to keep an eye out for. First of all, it's important to think about your loved one's baseline, their typical behaviors, and what you're looking for is a change from baseline. The first area is eating. So as Prader-Willi parents, I know we can get pretty excited if our child eats less or walks away with food on their plate. But if your child is consistently has less interest in food, isn't eating, isn't coming to the table for meals, this is a concerning behavior. You have to look at whether this is in the context of being sick or being on a new medication. But if those issues are not at play, then this is something to kind of pay attention to. The other thing, as I mentioned previously, is more agitation or aggression, especially in a kid maybe who didn't have these issues before. The level of talkativeness, as I mentioned, and withdrawal was another symptom that we heard, spending more time alone, less willing to engage in activities, especially for a person with Prader-Willi who was previously pretty social and liked to do things, and now they're saying, no, I'm not interested. And again, you want to see if these changes are kind of consistent over a week or so and not related to physical illness or medication change. The last 2 areas to highlight are changes in sleep patterns, especially sleeping less. Caregivers commented the naps just stopped, or he or she started staying up later and later at night. These were concerning behaviors. And 4th, grooming. And again, I want to emphasize a change in baseline. Lots of teenagers are not great at hygiene and grooming, but you want to look at what your child typically does. I know my daughter has a very particular way she likes to wear her hair in a ponytail with every strand perfectly, in the right place. And if that behavior changed for her, that's something I'd pay attention to. So if you notice that there are some concerning behaviors or changes in your loved one, first of all, I want to say this can be scary. The first step is to not panic and sort of take your own pulse. This is something that they recommend doctors do when they first start to work in the emergency room. Like if your patient is having a heart attack and you're not calm, then you can't help them. So do your best to remember that you're not alone in this and that there is help. So where can you go for help? If you have an established mental health provider, that would be the first place to go. But if not, you can start with a primary care doctor for your child, or if they're connected to a local PWS clinic, you could start there with asking for an assessment. Make sure that a thorough medical assessment is done. As it was mentioned several times, that illness, infection, medication reactions, and even an undiagnosed sleep disorder can cause symptoms that look like mental illness in Prader-Willi. Provide the doctor with information about mental health issues in PWS. As I mentioned, there are some unique factors. PWSA and IPSWA, which is the International Prader-Willi Association, have some great downloads on their website specific for physicians and healthcare providers. So you could print those out and bring those in. PWSA also has a great resource which is called a peer-to-peer consultation, where the doctor can call PWSA and request a consultation for mental health concerns, and the 2 doctors can talk. Many of the experts that I interviewed participate in that program. And finally, as I mentioned, there is a one-pager on the website that you can download, and you can bring that to the provider. So poll question 3, there'll be 4 poll questions. This is the third one. And in this one, we're interested in whether your child or loved one with PWS has seen a mental health provider, psychiatrist, psychologist, therapist, social worker, just to get a sense of how connected those in the community have been to mental health providers. Will probably depend a lot on age. I think the older you are, that might be more likely. So we'll give it a few more seconds for people to respond. And it looks like 60% have had contact with a mental health provider. So a little bit over half. Great, that's good. Okay. And I want to point out that all the information, I know I went through quickly about kind of where to get information for your providers, all that's in the web, in the guidebook on the website. So if you didn't get a chance to write it all down, you can go to the guidebook and it's all there for you. So treatment, let's talk a little bit about that. If the symptoms that your loved one is having seem to reflect psychiatric illness, medications will often be recommended. And the experts in the study, as well as caregivers, had a few tips on kind of how to think about this and how to manage this. So one is to make sure that the prescribing provider has reviewed the information on PWS mental health treatment. And came up again and again, this golden rule for medications in PWS: start low and go slow. Our kids can respond to lower doses to psychiatric medications than the typical population. And they can kind of over-respond and even have mood activation at doses that are thought of to be used in the typical population. So starting at a lower dose than expected and going up very slowly was recommended. Make sure your doctor knows all the medications and supplements that your child is taking, even CBD and things like that are kind of used off-label, so to speak, because they can have interactions with medications. Ask the doctor how quickly the medication works, so you know when you might see changes. And it can be helpful, again, to track behaviors so you can see whether there's an improvement or no improvement or worsening of symptoms. Caregivers in general tended to be really positive about medications for their loved one struggling with mental health issues. This was especially true when there were symptoms of more serious mental illness. One caregiver commented, "Don't be afraid to try medication. You may have to try a few before you find the right one, but honestly, it can really improve their quality of life a lot and yours." So this slide, and those of you who were at the morning session yesterday saw a version of this slide. I wanted to put this slide in. It's from a different study gathering data from the PWS Global Registry. But I wanted to show this to you all just to get a perspective on the use of medications in PWS from a larger sample. This slide captures data from over 600 caregivers who reported on medications that their loved one with PWS was taking for psychiatric and behavioral issues. The take-home lesson from this slide is that the use of medications for behavior and psychiatric symptoms is common in the PWS population, at least at this point. The percentage of people using these medications increases with age, and it's not unusual for our loved ones to be taking a combination of medications. I don't want this slide to be, I don't want the takeaway to be to kind of run out and put your loved one on medications. But I just wanted you to have a sense of kind of what is a common practice out there. I do think it's important for parents and providers to be very thoughtful about what medications might be appropriate, what doses might be appropriate, as I mentioned, and how to evaluate if they're helping and how to safely get off the medication if they're not helping. So now let's talk about non-medication approaches to mental health symptoms in PWS. When I asked about this to caregivers and experts, psychotherapy and counseling was one of the first things that came up. And both caregivers and experts reported that psychotherapy can be helpful for individuals with Prader-Willi, but with some caveats and guidelines. Good rapport with a therapist was mentioned as a key factor for success in therapy. And anybody who went to the physical activity and exercise for PWS talk yesterday heard that as well, that good rapport with a therapist was crucial for compliance and success. Caregivers mentioned that it was helpful if the therapist seemed to really genuinely like and appreciate all the great aspects of the person with Prader-Willi that they were treating. And also key characteristics for the therapist working with the person, according to caregivers, was the ability to be structured but flexible. So structured but not rigid and dogmatic, like things must be done this way. That usually doesn't go well. If you have too rigid people in the therapy room, it's not really a recipe for success. So structured but flexible seem to be key. Caregivers also mentioned that therapists who had experience working with individuals with intellectual disability and cognitive differences were most helpful. And at the end in the Q&A section, we can talk about maybe how to find some of those resources if people are interested. Concrete strategies seem to work best as opposed to more abstract like psychotherapy approaches. And some of these were kind of problem solving, skills, relaxation approaches, mindfulness, belly breathing. Those were thought to be helpful for loved ones with Prader-Willi syndrome. There are some great apps online that have some kind of kid-friendly versions that I think all of our loved ones with Prader-Willi might enjoy, whether they're kids or adults. And Headspace and Calm are two programs that can be kind of helpful in this area. Unfortunately, success with homework from therapy and using these strategies and practicing them was really dependent upon caregiver cueing. So it's hard for them to remember to do these things or to be motivated, but if caregivers or others kind of help them remember, there was more success. So now let's talk about another aspect of non-medication approaches, which is environmental approaches. Many of those interviewed stated that it's useful to look at potential environmental contributors or kind of stressors going on. Sometimes modifying the environment can help decrease behavioral and mental health symptoms. And this was suggested as an early first step, especially for behavioral challenges. The benefits were echoed by many of the caregivers. And sometimes these can be used in combination with medication for more serious issues. As a guide to think about this, you can think about the 3 R's. So reduce stress and stimulation by reducing activities, be consistent and create some routines and schedules, but don't be rigid, and review, are things helping, what seems to be helping. The 3 areas to think about would be school and other activities, sleep, and food security. Keep in mind that once a person with PWS starts to experience mental health challenges, certain environments that were previously manageable may now be too agitating or stimulating. In terms of school activities, parents suggested trying to create regular routines that can bring comfort and predictability. Predictability is very soothing to our loved ones, and this came up many times in the interviews. And ways to decrease stimulation, they reported, were helpful during this period of mental health challenges. Sometimes these changes were needed temporarily, and sometimes longer-term modifications were required for maintaining mental wellness. One very thoughtful comment from a caregiver was he had been doing really well in school, so we just expected that would continue. But high school was very difficult, and the stress of trying to keep up was too much. We started to see more and more mental health symptoms. I finally realized that we needed to lower expectations and prioritize changes that would reduce his stress to help him make it through. In high school, I heard can, because it's so stimulating, there's so much going on, can be challenging for some people with Prader-Willi syndrome because of that. Sleep was another area that was mentioned, that trying to help them be very consistent with sleep and rest patterns, and that a lot of our kids need at least 9 hours of sleep for mental wellness, and that not getting enough sleep for a period of time, especially in combination with a stressful situation, could be a trigger for greater challenges in mental health symptoms. Food security, something near and dear for many Prader-Willi families. Parents noted that inconsistent food security could be a significant issue affecting mental health. And again, this came up frequently in the interviews. What was recommended was that you quietly, again, if folks with Prader-Willi get wind that you're doing this, that's likely to increase anxiety. So to quietly, kind of under the radar, firm up on existing routines and schedules to increase the sense of security around food can help, particularly during times of mental health issues, help people with Prader-Willi feel safer and less anxious. One caregiver had a really insightful comment about this. Their child was doing so well, we were slow to recognize that the stress of it, lack of food security, was causing. She had an IQ on the higher end for PWS, so I thought that we could teach her how to manage the food. But I came to realize that even if your child with PWS is doing really well, they need boundaries around food. And comments from the mental health experts were, not locking up food can increase anxiety to intolerable levels, especially when they are vulnerable and in a mental health crisis or impending crisis. The person with PWS often wants the greater food security, even if they can't articulate it. It helps them feel calmer. They can feel that the food is silently calling to them. Caregivers also mentioned a variety of other strategies, which I thought were really creative and helpful, that could be calming to the person struggling with behavior and mental health challenges. And these could be used to both during a challenge or to prevent relapse of symptoms. And these can be incorporated into regular schedules or during the recovery period. And parents mentioned sensory strategies such as brushing techniques, horseback riding, the use of weighted blankets came up again and again, walking or regular exercise that they enjoyed, or listening to their favorite music or relaxation CDs. There are some relaxation CDs out there actually for children with autism that a few parents noted were very helpful. Poll question 4, the last one. And this question focuses on whether those in our audience, child or loved one with Prader-Willi, has an ongoing relationship with a mental health provider. Too much talking. So I'll be curious to see how many are already connected to a mental health provider. Give the poll a few more seconds. So kind of the opposite way of the last poll, a little bit more, about 60% are not connected to a mental health provider. So folks may have seen somebody, it seems like, from the last poll on maybe one basis, but are not regularly seeing somebody. And we can talk a little bit more about that in the question and answer period if needed. So one of the most important recommendations that came out of the interviews was don't wait to find a mental health provider. Early in adolescence, identify a local mental health professional that can work with your loved one. Again, if you're concerned, if there are issues or possibly if they have the UPD genetic subtype or other maybe risk factors, this might be particularly important. It's helpful to kind of find someone before there are issues so that they can get to know your child, to develop a relationship, and also get to know a little bit about PWS. Caregivers felt it was very important to find a provider who is willing to learn about PWS. It's unlikely that you'll find an expert out there. There are so few. And that if the doctor or therapist was not open to being educated about PWS, then it was time to find a different provider. And sometimes you had to look for quite a few before you found someone who was a good match. And I want to end with some words of wisdom. And at the end of the interviews with parents, I ask them, kind of, what have you learned from going through this with your loved one? And what would you want other parents to know? So I'll just read these. Reach out early if you have concerns. Don't wait or think it's just a phase. Catching it early can make it easier to treat and easier for them to come back to their normal self. Don't be afraid to say to the doctor, I'm seeing this. I might be nothing, but I'm concerned. Another caregiver said, sometimes it's hard to realize how bad things have gotten. You get used to it, but you can take a step back and ask for help. I think that's true for a lot of aspects of Prader-Willi. There can be so much going on that you're just dealing with every day that it really can be sometimes hard to take a step back and say, wait a minute, this is really, we need to get some outside help here. And last, to remember this is temporary. I thought this was a great comment. One of the hardest things to watch your child go through is something like this, because there's a fear that this is the new normal. For us, it took a few years to get it all sorted through, but at 23 years old, we have the right medication, good support, a stable living situation, and his mental health is actually good. Please make sure you tell the other parents that they do come back to you. That sweet kid is in there. And I heard that echoed over and over, that that sweet kid or your kid comes back to you once you find appropriate treatment and help. And the last comment, I think it's really important for parents to be a team when you're going through something like this. You need someone to partner with to manage this, even for your own mental health. If this isn't the other parent, then find a friend or other PWS parent that can help you think through things, make decisions, bounce ideas off of, and listen to you vent. This can really, really help. And also, I will add, take care of yourself, not only for ourselves, but for our loved ones. Our children absorb our stress, so if we're doing better and taking care of ourselves, it does help our kids do better. And I want to end by reminding everyone that the full guidebook is available on the website, and to acknowledge that we are grateful to the Mariah Foundation for providing a grant to support the guidebook project, and to thank you to all the parents for agreeing to participate in this study and sharing their deeply personal and difficult stories. As well, thank you to the PWS mental health experts who are incredibly generous with their time, giving interviews and providing feedback on the guidebook drafts. The experts who participated are listed on the slide. And now I'm going to say thank you for listening to this long talk, and it's time for questions and answers.
So the first question that we have here is, when a child with PWS has a temper event, I heard that you should always look them in the eye. Is that correct? And how best can you help a child manage the outburst, screaming, etc.?
Well, I will say that this project focused on more serious mental health issues, even though temper outbursts can be serious. So I didn't focus specifically on strategies for managing outbursts, but I'll point you to a few sources. So first of all, Tony Holland is going to be giving a talk on Friday. I don't remember what time, but maybe
at 1:15 p.m. Eastern Standard Time. So the same time on
same
Friday.
time as today, but on Friday. He's a psychiatrist who's worked in this field for many years, and he specifically is going to talk about behavior management strategies. But there are a number of resources. And last year we had Patrice Carroll from Latham, who runs the behavior program there. That's a PWS residential program. And she also has a number of strategies that should be on YouTube from our conference last year, you can access. And Jan Forrester at the Pittsburgh Partnership, which you can find them online, has actually some really great tip sheets on how to manage tantrums and things like that. And interestingly, I recall from reading her tip sheets that you actually shouldn't look them in the eye, that, you kind of maybe more of a sideways approach of kind of helping them calm down and giving them some space, that actually looking them in the eye or talking to them while they're having a tantrum can be a little bit like pouring gasoline on the fire. So as long as they're safe, what the recommendation I usually hear is kind of giving them some space to calm down. And I know that's what we do with my daughter, or sometimes we'll tell her to, give her some time to make her feeling smaller, is one of the phrases we use. And then I say, I'll be back to check on you in a few minutes. And that usually works well over years of kind of training.
Well, the next question is how to deal with rigidity and defiance.
Again, really, that's probably one of the most challenging and maybe underrated behavior challenges of Prader-Willi. Doesn't get talked a lot about. I'm hoping that some of the clinical trials that are going to be on the horizon will help to address that behavior. It can be quite difficult. I think that approach of being structured but flexible is really, really important. It's important to not get in a power struggle as best you can with your child with Prader-Willi, because that just tends to increase the rigidity on their side. So if you can give them choices, or maybe even take just a break from the conversation and come back to it, sometimes that can be helpful. And I would encourage also for you to go to the session on Friday with Dr. Holland, and he will likely have some ideas about that as well.
Yes. Our next question is, could you talk a little bit more about the behavior tracker or the apps that they can use, which you had mentioned briefly?
So I don't use any of those myself, but I'd heard from other parents that there were some online that they use or found to be helpful. I would just suggest looking for, kind of do a search on behavior apps and see what's useful. I'm pretty low tech, so I just really put a mark on the calendar, or even just put like a star on my phone to monitor, to track behaviors. I find that the easiest for me personally. So it doesn't need to be fancy. It's just for your own sense to see, are things really increasing here or decreasing, or just to help you remember that. Again, there's so much going on, I think, when you're parenting a child with Prader-Willi, that it can be sometimes easy to lose track of what's increasing, what's decreasing, and what the baseline is.
Great. Okay, so this is a little opposite of what you talked about earlier. So they have an 11-year-old boy who cleans him. It sounds like he cleans maybe too much. He changes his clothes many times a day, washes his hands many times a day. And they wondered, is this something that they should maybe get checked out or need medication for?
I'm not going to diagnose over over the internet. Those certainly could be symptoms that are consistent with obsessive compulsive disorder. We do know that a percentage of our kids do meet criteria for obsessive compulsive disorder, and more kids have some symptoms but don't meet full criteria. And we also know that those who struggle with that can respond to medications in that area. So it might be worth getting an assessment, especially if, when you get concerned about obsessive compulsive behaviors, is when they start to interfere with function. So are they not able to get out the door because they have to keep changing their clothes or washing their hands, and they miss the bus? That's when I think it would be important then to get an assessment. And you probably would want to try to see a psychiatrist as opposed to a primary care doctor in that situation. Again, our kids can be sensitive to medication, so you want to make sure that someone really takes into consideration all the unique aspects of our kids.
Great. The next question is, we're having considerable difficulty finding mental health providers for adults with PWS in Illinois. What are some resources or help they can get trying to find somebody in the state?
Well, I will say that being, I also work at a medical center clinically, and that it has been, especially in the pandemic, it has been hard for everybody to find mental health providers. I mean, I think this was true before the pandemic for our kids, but probably even harder now. One of the things, so that's why it's helpful to look before things are a crisis, because it may take several months to find somebody. I think the best ways maybe to find someone who might be a good match for your loved one is you can ask primary care doctor, or if there's a PWS clinic in the state for referrals or recommendations. Also, a lot of caregivers and also myself personally have found that if a care provider has some experience working with people on the autism spectrum, they often also can kind of appreciate some of the differences our kids have and can be a good match. So you could contact local autism advocacy group or organization. Earth Children's Hospital there has an autism clinic. They might have a list of therapists that you can connect with.
Great. The next question is about social anxiety. So tips for facilitating friendships and easing anxiety when the anxiety is driven by the lack of friends, but all techniques are being implemented to help with socialization. We didn't really talk about social anxiety in the Guidebook project, so I will just sort of tell you what I know about it separate from that project. I think a lot of times our kids do have social challenges for lots of reasons. Part of it is social cognition. Sorry, I just got a message popped up, but it's something different. Has to do with social cognitions, kind of understanding that reciprocal back and forth. Sometimes there are issues like hyperphagia and other things that interfere with social connections. I think or kids need a lot of facilitation. So having them just kind of go over to a friend's house for a play date or hang out on their own is probably not going to go that well. So a parent or a caregiver kind of helping facilitate that social interaction is often useful, as well as having some structure to it. So hanging around and chatting can be hard, but if there's a game that they're playing or watching a TV show together or doing a craft together, putting some structure to it can be helpful. And one-on-one, of course, is easier than a group to start with. Great. Okay. This one's kind of multi-part, so I'm just going to ask. Okay, so they said that they were advised that with UPD, if the genetic affected area has more than 10 MBs, theirs was over 30, that is asleep, the possibility for non-medallion disease increases, especially the upline generation and family, such as schizophrenia, bipolar, etc. So they were wondering, how likely is it that their young child will experience the same type of mental illness as family members?
So kids with UPD are at increased risk for, some serious mental illness challenges. Our children are not only, Prader-Willi, there's more to them than that. So they have other genetic influences from parents and family as well. So, I think if there's also a family history of psychiatric problems, that likely on top of the Prader-Willi UPD risk, that probably would increase risk, but I'm not the best person to comment on that. But it probably would be good to find a psychiatrist who is to start a relationship with, an ongoing relationship with, to kind of talk with them and just keep an eye out for these symptoms. I know my daughter has seen a psychiatrist for since she was probably about 11, and every year when we'd go back, I would say, so can you assess her for psychotic symptoms, because she has UPD? So, and we'd kind of do that dance, so to speak, just to have kind of a mental health check-in. So something like that could be useful.
Great. Our next question is, my son with PWS and major anxiety and OCD issues, can we expect that this will just get worse as he gets older, since he's experiencing it so young? Oh, they said, they put a parenthesis, they did not say the age, but I think their son is around 8, 9, or 10-ish.
I guess what is hard to know, of course, but, I think early intervention is often the key. So it is highly possible that if you kind of can get some appropriate treatment, younger kids we tend to want to maybe stay away from medications and focus more on behavioral interventions. Psychotherapy, ABA can be helpful sometimes. And I think if you can get those, get some good coping strategies in there for the parents as well as for the child, that you may see those symptoms be much better managed as they get older. The other thing about, it's not, as our kids get older, and I've certainly seen this with my daughter, their brains develop and they do develop more capacity for coping strategies, and being able to learn new ways of managing things. So that's happening as well. And I think that's something to remember.
The question that followed was very similar to the last question, but it was even talking about a younger age, like age 3. Should they be starting to address issues? Obviously not with medication, but other.
Yeah, I would say probably good to get somebody, some provider helping out. And, I know ABA therapists, again, most ABA therapists are trained to work with people on the autism spectrum. So they would need, similar to psychotherapists, to be willing to learn about Prader-Willi and the unique aspects. And we also have a video on our website that is was done, I think, last year by a parent who's also an ABA therapist about how to adapt that therapy for PWS. It'd be great for the parent and any ABA provider to watch that. But that might be a place to start to just, kind of pay attention to that, and to get some, maybe as they go into school, to let the school know. Schools can be really helpful implementing strategies to manage behavior and anxiety.
And I just wanted to point out in the chat, I see that it looks like a few families have said that they've had success with neurodevelopmental psychiatrists for their young kids, that they're not PWS specific, but they have expertise in neurodevelopmental conditions.
Yes, that's a great point. If you can find somebody like that. The other specialties, sometimes neurologists. There are neurologists many neurologists also have training in psychiatry, and there are kind of neurodevelopmental neurologists, and they can be a great resource and a person to kind of assess and look at use of medications.
Great. The next question is there an age at which imaginary friends become more of a concern for mental health issues as opposed to typical behavior?
As long as it's not interfering with things. So, again, I talked about that. You kind of want to pay attention to whether it's increasing or has a sense of agitation to it, or the friends are being mean. That would be concerning for kind of moving more into psychiatric issues that might need to be assessed and possibly treated. On the other hand, if someone is really talking a lot to themselves and it's interfering with work or school, because it's disruptive to other kids, then you might want to work on some non-medication approaches to managing that, or helping the person learn some other coping strategies. Usually, again, imaginary friends is kind of a soothing or an anxiety management strategy that they've come up with themselves, which is great. But sometimes that needs to be shifted to something that is a little more sort of socially appropriate out in the world.
Great. This question is kind of a follow-up then to about the provider. So this person's asking, what type of mental health provider should we be looking for our child or adult?
I think it depends what you're looking for. If you want a diagnosis, you probably want to go to a psychiatrist who is an MD. So psychiatrists, I always want to make this distinction. go to medical school. They have MD, so they have all the medical training that regular doctors do, and then they specialize and do residency in psychiatry. So again, they can prescribe medications, and they tend to be a little more focused and experienced on actually diagnoses. Psychologists or social workers or therapists are not MDs. They can't prescribe medication, but sometimes if they know lots about, kids with neurodevelopmental disorders and medications, they can kind of give some guidance on that. But they would focus more on therapy techniques. So I don't know if that answered the question, but it depends on what you're looking for. Yeah.
Great. The next question is, does the guidebook include preferred medications to start with by diagnosis or symptoms?
It does not, because again, we can't really, it's so unique to the person in the situation and what other medications they might be taking and any other health challenges they might have. The guidebook does include the medications that parents told us that their child is taking, just so you can kind of see a list of medications and the percentage that we're taking this or that. But it doesn't kind of match what medication would be most appropriate. In that situation, I mean, I highly recommend if you're working with a psychiatrist and they want to, or a primary care doctor, understand what would be the best medication for the symptoms in your child, for them to consult with the PWSA peer consult line. That, again, most of the experts I interviewed participate in that program, and then they could talk to your doctor and hear about the symptoms your loved one's having, and they could probably give some very specific suggestions about what medications and what dose. I mean, I don't want to speak for them, but I think that's the kind of information they would give.
Great. I also just want to let everyone know I put a link to our website where the mental health guidebook can be found. I had a few questions of people wanting to make sure they could get access to that. So that is in the chat. The next question is, when should you start to consider residential care? Do you have any?
Yeah, again, that's sort of beyond the scope of my project, but I guess I would say this, similar to trying to find a therapist. I think it's probably a much longer process. And so you probably want to at least educate yourself about it a while before before you're in a crisis, but a while when you think it might be something you're interested in, then I would start to look for resources in your area. Most states have a PWSA chapter, and often they will have, or chapter president, and often they will have, might have some information about local residential facilities, group homes, supported living situations that have been successful for people with Prader-Willi. You could also possibly call the main PWSA line phone number, and they would probably could help you get started as well. Talking to other parents about what they've done and where they've had success, it would be another great resource, and you could post on one of the Facebook groups or something like that.
Great. The next question is, it was mentioned that PWS individuals respond to lower doses of medication. Does this extend to non-SSRI meds?
Most of the research that I recall, Jan Forrester has done most of this research, she's a psychiatrist, does have to do with SSRIs and having some mood activation with a higher dose, or even a more typical dose. And I cannot recall for other medications if they see that. But I know that many of the families I talked to, and my daughter included, is on pretty low doses of things, and that seems to be helpful. So again, I want to emphasize that, so you can start low, and if you're tracking and monitoring symptoms, you may not need to go up higher.
Great. This question is, I'm seeing research that growth hormone therapy can help increase anxiety and the levels between UPT and deletion. If the anxiety is heightened due to the medication, do you find that other options, meditation, calming strategies, can help, or is it considered more a side effect of regular medication?
If you mean side effect of growth hormone I think that's what that question is asking. I have heard that as well. Although I haven't heard that that's a very common side effect, but I think it can be. I do think that consistent practice of the mindfulness or relaxation or belly breathing is helpful for anxiety for all of us, for us and our kids. And the other thing, there's been quite a bit of research, not in Prader-Willi, but in the typical population, that regular exercise, even just 20 minutes of walking a day, is helpful for both depressed mood and anxiety. And I think this would probably apply to people with Prader-Willi as well. So doing all those things to help manage the kind of non-medication approaches to manage the anxiety can help with any side effects as well.
Great. Next question is, most of the medications have a tendency to increase drowsiness and sleepiness, which is detrimental to physical routine. Any advice?
Again, you talk to the provider who's prescribing it. And I appreciate what you're saying for sure. That can, most of them do have that side effect. So the timing of the medication can be important. What parents talked about, that sometimes they had to take medication at nighttime before bed, so that by the morning the kind of grogginess wore off, or sometimes they split the dose, so they take one and half in the morning, half at night, to have less fatigue during the day. I appreciate that it's a challenge, because it's like you take one medication for this and one other thing for the side effect, and then after a while you're on a bunch of medications. I see this with my patients I work with at the university as well, who have a variety of chronic medical issues. And so you have to sort of take a step back and try to figure out what's helping and what's worth it. And but there are ways to get around the fatigue, and most people, including our kids, do build a tolerance, so they sort of get used to the medication, so the fatigue and sleepiness becomes less of an issue.
Great. All right, and looks like we have one more question. Our PWS grandchild likes to ask questions about death, jail, being arrested for doing something bad, gruesome things, all without apparent fear of emotion, just information. Should this be something we should be concerned about? Should we investigate this more?
I have not heard about that in particular as an issue. So I probably wouldn't be the best person to address that, but I would say if you're concerned, it wouldn't hurt to kind of get that, talk to somebody who might be able to assess it further. Sometimes our kids just do have a curiosity about things and are trying to understand it. It sounds like maybe some of that might be related to anxiety. I'm not sure, but I'd say explore it further with a mental health provider who's willing to kind of dig a little deeper to see if there's what might be kind of contributing to that.
We have another question come in. Their teen or adult has become obsessive about smoking and cigarettes, and wondering how to manage that.
Oh, I feel for you. Just smoking is so addictive and so hard for, anybody to stop that behavior. I would say that you could explore some of the things that help other people. I mean, first of all, you have to get the person to want to be willing to quit. And that can be challenging, but highlighting some of the potential risks and things like that. And if you can get them on board with willing to try to quit smoking, then you can try some of the strategies that are, out there available for typically developing people.
And I followed up by saying that he says he's not hungry when he's smoking, so that's
and that's a tough one. Again, I would probably get some outside help to kind of work with that challenge. And if there's a PWS clinic at all close to you, or someone you could consult with, they might be able to have some ideas about that.
Perfect. Someone was asking, you had mentioned maybe it was a tip sheet by Jan Forster. They were wondering how they can access that. That was in the chat.
If you go to, I'd have to, it's, I don't know, Melissa, if you're able to find the link. If you look up Pittsburgh Partnership, Jan Forster, or anybody else can go on Google, there's quite a bit of information there. So Melissa can post
Yeah,
those.
I'll put the link that I found, and then hopefully that'll help people further.
I know that Dr. Forster and her team are also available for consultation for more serious challenges with PWS. So that's another resource that you can find online on her website.
Okay. I don't know who they're, someone asked if maybe if you have a website, they'd love to see the video you're talking about. And I might have missed it while I was Googling if you had just said something. Were you saying Dr. Forster had a video?
No, Dr. Forster, although she might have a video, but no, I'd said that she is available. I believe you can hire her for consultation for your child or your adults with if they're having kind of severe challenges, and that information is on that Pittsburgh Partnership website.
Okay. And they say it was recorded last year. Okay, so we I was just talking about Patrice Carroll. Yes, and Patrice Carroll, all of the videos that were recorded last year at our conference are on our website. So you can look there. So Patrice Carroll was part of that. And actually, we also interviewed Dr. Forster last year as well. So there is there should be a YouTube link for their presentation last year as well. And then in the chat, we've also included the link to the guidebook so that you will be able to go download it. And did you have anything else you wanted to share about the guidebook, Lauren, before we end?
I just saw a question go by about age again, and I know that other parents have kind of asked me, like, at what age would you start to, kind of pay attention or maybe get your child an assessment? And as I mentioned, most of the caregivers in the study stated that about 75% said that their kids' really significant mental health issues started around age 12 or above. So, I'd say around age 11 or 12, if there weren't already challenges showing, you might want to take them in just for a mental health checkup, like you do with your car, just to see how things are going. But I would encourage people to, kind of take a look at the guidebook. It's got a lot more information than what I was able to cover today. And there's also a one-pager in there that you could print out and give to providers. And there's also a podcast, actually, that Susan and I did, I don't remember, during the pandemic, about mental health issues that, takes a lot of information from the guidebook, but also some additional, you could listen to that as well while you're buzzing around the house doing something, taking care of your kids. You can feel free to reach out to me directly if you have questions. I think my email is probably on the guidebook or something like that, or somewhere. I appreciate you all coming today. I know this is a hard topic, and I'm happy that so many people came and are getting educated and informed. And we really, that's the way to manage it, is to kind of educate ourselves and, as they say, forewarned is forearmed, and to really be prepared and help our kids. And, the comments from parents about how, it was really hard to maybe find the right treatment or provider, but once they did, it took some time, but eventually that kid comes back to you and they're your sweet, loving, funny child who's able to kind of be more successful in life. So